Hi, everyone. My name is Dr. Tamara Pack. I'm a PhD, MD candidate, as well as an analog astronaut candidate. My background is primarily in psychology.
Hi everyone, my name is Dr. Maria Harney. My background is in psychiatry and emergency medicine, and I'm an analog astronaut. And today we would like to share with you the subject of Astro-Psychiatry, novel solution to mental health for long-duration space exploration. Before we start, I would like to give a quick definition of psychiatry. It's a medical specialty devoted to diagnosis, prevention, and treatment of mental disorders. Astro-Psychiatry is an emerging field of psychiatry that we are pioneering and would like to share our thoughts with you today. There are many factors that influence in the mental health of astronauts here on Earth, but also in space. And we like to think about those factors in terms of 3 Ps: physical, psychological, and physiological. I'd like to divide physical factor into 2 subcategories, which is environment-related issues like radiation, microgravity, CO2 concentration, and habitability, because astronauts who go into analog missions here on Earth, or astronauts who go to space, they live in isolated and confined environments. They have lack of sensory stimulation, they have high workload, and often they experience imbalances between work and rest, and they have lack of privacy. Then, of course, the second factor is psychological, which is connected to boredom, monotony, has emotional component, mood lability, feeling of discouragement, and subset of psychological factor is interpersonal factor, which is self-explanatory. And the third big factor, the third P, is physiological aspect that we're gonna touch upon a little bit later when we discuss the altered gravity environments, but those are issues common due to space environments like vacuum, temperature, and radiation.
So despite years of training and preparation, we found that many astronauts still find isolation challenging. And as you recall, during the pandemic, the entire population was forced into isolation and confinement for long periods of time. And people who currently struggle with mental health disorders are obviously at a greater risk for struggling with confinement and changes to their routine. As you can see by the chart that we have presented here, as time in isolated confined environments increased, the incidence of depression as well as anxiety also increased. Human factors, we found, play a big part in the severity of symptoms, as did coping mechanisms and support systems. In isolated confined environments, I'll give you an example. So we all have that one coworker that we just cannot stand, their voice even irritates us, right? Imagine being trapped in a small room with that person and you're unable to leave, and you're literally, a couple feet apart from that person at all times, unable to escape them or have any separation from them. As you can imagine, you would start to get irritated, anxious, kind of snippy with each other, communication breakdown. So human factors definitely play an important role in the success of a mission. If you can't communicate, the mission will not succeed.
And of course, we have to mention for how long you're going to be trapped with this co-worker. You have to probably about 900 days on the way to Mars and on the way back. So it's a long time that you have to be trapped in one confined environment with your co-worker. And the most common issues that astronauts are experiencing living in those what we call isolated confined environment is anxiety and depression and fatigue. And we saw increase of the numbers for anxiety and depression here on Earth during the isolated times. The same we see for the astronauts in space, the same we see sometimes in astronauts post-mission. Same depression, anxiety, also other issues like alcohol abuse or readjustment, but also a positive thing, Earth appreciation. I also can say that certain psychological issues we experienced among the crews during our analog simulated missions. I was part of 5 in-person analog missions and was part of remote medical team during the high fidelity Nepal missions in 2019. I was a astro-psychiatrist, and my duty included medical and psychiatric screening of astronaut candidates, video conferences, and interviews with each astronaut candidate, addressing their possible issues and behavioral health, which of course was very important also here on Earth during the isolated time, the risk assessment. I was also involved with training of assigned crew members and evaluating astronauts pre-flight, in-flight, and post-flight.
So with numerous factors influencing astronauts' mental health, we felt the need to pioneer and develop an integrated, comprehensive solution that would offer the best of psychiatry and psychology working synergistically together. And thus the ISPS-VETA was born. So as a novel concept, ISPS-VETA will offer integrated, personalized mental health assessment and evaluation. This will also include preventative and mitigation countermeasures, as well as using predictive analytics that will continually adapt and evolve to the individual's unique needs, and which will ultimately enhance the mission success. So ISPS-VETA stands for Integrated Space Psychiatry System, Virtual Embodiment, Tele-Avatar. The role of an astropsychologist versus astropsychiatrist. So because psychiatrists are trained medical doctors, they're MDs, they can prescribe medications, and they can spend much of their time with patients on medication management, diagnosis, as well as treatment. Psychologists, on the other hand, were PhDs, and we focus extensively on psychotherapy, which you more commonly know as talk therapy. And we frequently treat emotional and behavioral issues, as well as improving cognitive distortions and helping to provide coping mechanisms and resources, enabling an improved quality of life. So currently there's no data for space psychiatry. The focus has always been on astropsychology. So we decided to pioneer this because why not have the best of both worlds working together for better outcomes and more successful missions?
Because ISPS-VETA combines 2 models of astropsychiatry and astropsychology, we created this integrated system to better address the well-being of the astronauts, because we hypothesized that the mental health disorders occurrence will increase with the growing commercial sector and the space tourism, due to the factors that we previously discussed, which is physiological, psychological, and environmental, physical. But also we're looking to expand and make the addition to DSM-5TR, because we see that that would be needed, because astronauts are dealing with the altered gravity environment. And we also think that the mental health issues can potentially present themselves differently during astronauts being exposed to those altered gravity environments. And there are, of course, many sections in DSM that we are looking to contribute, which is sleep-wake disorders, anxiety, depression, neurocognitive disorders, eating disorders, and many more. It is well known that the long-term exposure to hypogravity causes a number of physiological and biochemical changes. The most common that are mentioned is negative calcium balance, resulting in the loss of the bone and the muscle atrophy, and changes to cardiovascular system that lead to orthostatic intolerance, and of course fluid shifts that you can see on the slide. However, the understanding of the impact of the prolonged exposure to those altered gravity environments and examining effects in different physiological systems in will become extremely important, not only from the perspective of the medical emergencies, but also from the perspective of the mental health of the astronauts. And before we move forward, I would like to say a few words about the DSM and how it was developed. And what is DSM? It is currently a gold standard that used in psychiatric diagnosis and treatment here on Earth in 1G environment. And even though we cannot analyze how mental disorders been classified throughout human history, we can say a few words about how DSM was developed. And pre-World War II, during pre-World War II in 1917, the American Medical Physiological Association, together with the National Commission on the Mental Hygiene, gathered uniform health statistics across the mental disorders. And after the Second World War, a much broader classification system was developed by the US Army, when the 10 categories of psychosis and psychoneurosis and 7 categories of disorders of the character, behavior, and intelligence were added. Moving forward with DSM-3 and DSM-4, the numerous changes were made with classifications and descriptions. However, for DSM-5 TR that we have right now, DSM-5 TR did not include conceptual changes to the criteria. However, a lot of necessary clarifications for certain diagnostic criteria were reviewed and developed further.
So ISPS-VETA is AI and deep learning. So by leveraging the DSM-5 existing clinical data from similar patient diagnosis and ice conditions, crew entries, VETA's deep neural network for takes data paired with convolutional network for image data will be able to identify astronaut stressors to provide diagnosis of elevated stress and get recommendations to affected crew via ISPS-VETA. So a little bit about image data. It picks up on all the important and quite frankly overlooked nonverbal cues such as facial expressions, eye movements, tension of the jaw, body language, and a little bit about how the deep learning works. So deep learning neural networks or artificial neural networks attempt to mimic the human brain through a combination of data inputs, weights, and bias. Now, these elements work together to accurately recognize, classify, and describe objects within the data.
And we touch based on the technical aspect. However, I would like to share with you how ISPS-VETA works in terms of the from the user perspective. You can access ISPS-VETA platform on computer or mobile device. You have to log in into your account, and you need to create your account and log in and input a personal data. And then ISPS portion of the program is engaged when AI analyzes patterns of behavior. And then the VETA component is engaged if the user exhibited a behavior outside of the normal baseline. Then the ISPS-VETA can offer personalized mental health management like diagnosis or therapeutic management or pharmacological suggestions. Individual user can engage with the platform. He can interact with the avatar, engage with various activities like sonic frequency meditation immersion that will allow for the user to distress and reduce anxiety and basically bring the user back to the normal baseline. They can also teleport into various AR environments. For example, if you want to take a walk on the beach, you can. And the user can also engage with psychologists for the cognitive behavior therapy.
Cognitive behavioral therapy. With cognitive behavioral therapy, you're in essence unraveling and restructuring someone's unhealthy thought process and changing their perceptions. So thoughts, emotions, behaviors, they all affect each other. And when one's compromised, the other two are affected. So if you look at the diagram here, you can see it kind of ends up being a loop. So you get stuck in this never-ending loop of unhealthy thoughts and behaviors, which leads to an increase in sleep disorders, obsessive compulsive disorder, depression, anxiety, and all these things are very treatable with cognitive behavioral therapy. Now you can learn techniques, for coping with stressful life situations, managing your emotions, dealing with grief, loss, or trauma. Now, in some cases, cognitive behavioral therapy is most effective when it's being combined with other treatments like antidepressants or other medications, which is why ISPS-VETA is so amazing. You're getting the best of both modalities that are working synergistically together to give you the best outcomes and thus ensuring the most successful mission.
Not only integrates two modalities, it also is part of the analog space clinic, because ISPS-VETA integrates psychiatry, psychology, and human factor, but we have tested it in our analog setting using components of it to improve the well-being of the astronaut. And that's exactly what we would like to achieve with ISPS-VETA and develop further, which is a mental health management of the astronaut, training and evaluation analog astronaut crews, commercial astronauts, and space tourists. We would like to grow our knowledge base and potentially make some adjustments to DSM-5. Also, we continue collecting the data, we continue to analyze data and engage with predictive modeling as well. There are a few thoughts in conclusion that I would like to share with you, which is many predictions for long duration spaceflight are very hard to make, and not only about psychology and psychiatry, but also about the physiology. But in the end of the day, it's all interconnected. And we have to look at this situation from various perspectives, and that's why ISPS-VETA is so unique, because it is integrated, personalized system that addresses the 3P factors and promotes the well-being of the astronauts. Of course, we have to keep in mind the commercial sector is growing, the space tourism sector is growing, and we need to incorporate the valid system of mental health management into our space clinics to get ready to go into space. Thank you very much.
Thank you.